Today's topic is the issue of risks and benefits in study design. This topic is related to nearly every other topic in this course. For example, study design affects what needs to be disclosed to participants in the informed consent process. It affects recruitment because it can determine the inclusion and exclusion criteria used. And it affects how well we can protect privacy and confidentiality. Given time restraints, we have not looked at all the different kinds of study designs that are frequently used. For example, qualitative research or the use of surveys, existing data in epidemiological studies, or randomized clinical trials. Apart from the one issue of placebo-controlled trials, which is particularly controversial within the field of mental health research, we've really focused on more general issues. What kinds of risks and benefits exist? What are some general normative guidelines in weighing risks and benefits? And what are some processes that can be used to ensure that we've included participants in trying to determine what is actually beneficial or risky?
Safe and ethical research must include the participants of research in helping to define the research agenda, and also having them provide input into the study protocol. And finally, enabling them to gain access to the research findings. The point of departure is the reciprocal relationship based on mutual respect, trust, and the willingness to collaborate. On the other hand, researchers have the responsibility to ensure the safety of the study protocol and to design a course of research that is relevant to the needs and the treatment preferences of behavioral health consumers of treatments and services.
Today we'll be presenting excerpts from an interview with Dr. Joan Sieber. Dr. Sieber has written over 60 articles in the area of research ethics and psychology in a very successful textbook, Planning Ethically Responsible Research. As we began our discussion, Dr. Sieber explained that she's not really an ethicist so much as a behavioral scientist who works in the area of ethics. So I asked her, how does she see the relationship between ethics and behavioral science research?
Ethics can tell you what you ought to do, but it takes empirical research to figure out how to accomplish that.
It's easy to understand how many of the topics we're addressing in this interview series are ethical topics, for example, informed consent or protecting privacy. But today's topic, study design, it sounds like it's simply a matter of science. Why do you see study design as an ethical issue?
Scientific issues are related to ethics. The main concern in study design is scientific validity. If research is not valid, why would any human participants want to be involved in something that was going to provide misleading information? And why would anyone want to put resources into a study that was poorly designed? So ethics and validity go hand in hand.
What are some other ways that study design is related to ethical issues?
Well, there are many ways. Let me give one, and it's by way of pointing out that if you are concerned with ethics, many of the questions that you ask are questions you should also ask if you're concerned with study design. For example, when I get information about human subjects, is it going to be information that's sensitive, information that will embarrass them or that can be used to harm them? Now, of course, ethically, you don't want to harm people, you don't want to embarrass them, but also methodologically, if you ask sensitive questions, people are quite likely to handle the situation by not giving you an honest answer. And so you have damaged the scientific validity of your study.
There's a two-way street with harm. Study design could contribute to the harm of participants, but it could also harm the quality of the study itself.
Yes.
You mentioned that the data we gather sometimes could cause someone embarrassment or they may feel that their privacy has been violated if confidentiality is breached. And yet here we enter into what seems to be a very subjective realm. Something that embarrasses me may not embarrass you. And so how can we find out what participants might find embarrassing or harmful?
Well, the first thing is to understand what you understand, which is that you are not truly in a position to know what is private for other people or what they would want kept secret by you, the researcher. Having mastered that concept, you then need to find ways to get into the mindset of the people that you'll be studying. And if those people are situated quite differently from yourself, you will have to become rather creative about that. You will need to do what we call community consultation, perhaps, which is to get a group of people from the same population that you'll be studying or of their advocates together and explain to them what you're going to do and ask them what things would be sensitive, what things would be private, where is confidentiality very important, where will people have worries about you're learning things about them that they don't want people to learn. Another technique is what we call the surrogate subject technique, where you invite in people who are like the people you're going to study, and you say, I'm going to take you through a simulation of what it's like to be in the study. And I want you to be thinking about the people like yourself who are going to be participants in the study. What are some of the things that you think they will worry about? And it's kind of nice to phrase it that way, because that way the person doesn't have to say, this worries me. They can say, this will worry other people.
Sometimes when researchers do try to engage community members, they're a bit taken aback when someone asks them, what's in it for me? Is this a legitimate question, and how should researchers engage it?
Well, everyone is concerned with what's in it for them. It is a legitimate question, particularly if the research participants feel that they have been overstudied, that they've been everyone's guinea pig, that these high prestige people come in, get more prestige by studying them and leave nothing in return. And so, yes, the researcher does need to think about what benefits he can give to the community or to the individual participants. The researcher also needs to ask himself, well, who is doing the asking? What is that person's political agenda, if any? And after I understand that political agenda, is it then legitimate for me to support that agenda?
IRBs often ask researchers, what benefits will your research offer? And a very common reply is to say that it will benefit science and society. Is this an adequate response?
In a word, no. It's a very presumptuous response. For one thing, no single study can be expected to benefit science and society. Maybe over the long term, a very successful program of research will make a difference in the world. The main people who say that they're going to benefit science and society are freshmen, but a lot of other people do that too. There are many other benefits that one can give to research participants.
What are some of the different kinds of benefits that a researcher can offer to participants in their communities?
Well, a good way to think about benefits is to think of the several categories of benefits and then to fill in specific benefits appropriate to the context. I think of the several benefits as falling into the following categories. The first and easiest and most obvious benefit is relationship. A respectful, open, two-way, reciprocal relationship in which the participants feel appreciated. They feel that they can raise issues with the researcher. They can come back and contact the researcher or the project later, reopen a dialogue about something that is of interest to them that may also be very useful to the researcher. There is knowledge. The researcher knows a lot about the topic and has obviously done an extensive literature review and can very well select some useful concepts to communicate in layman's language appropriately that will be useful for the participants to know. there is training, and often that training brings with it the ability to help one's community and to empower oneself and to earn status. There's material resources. There may be books, videotapes, or anything that the participants need that the researcher can appropriately and affordably provide. And then there is the treatment itself. Now, we don't know if that will be beneficial, but ideally, it turns out to be beneficial.
Apart from the participants, are there other beneficiaries of research that we need to consider when we're evaluating this issue of benefits?
Well, there certainly are. There's the community of the participants, one's own institution, the funder, your scientific society, science as a whole entity, and society in terms of the general public.
In reviewing research, we need to look not only at the issue of benefits, but also at the kinds of risks and harms that can arise in a study. What are some of the different kinds of risks and harms that can arise?
Well, it depends somewhat upon the context, but I like to think in terms of 7 categories of possible harm. And then once you have that as a template or a heuristic, you can see how they might arise in relation to the particular study that you're going to do and the vulnerabilities of the particular people you're going to study. And those 7 harms are inconvenience, physical harm, psychological harm, that is stress or emotional harm or worry, social harm, that is some kind of stigmatization where the person is reduced in the eyes of others, economic harm, legal harm, or harm to the community.
Well, I think that's actually a very helpful heuristic because very often researchers, I think, conceive of harms just in physical terms, and we often hear behavioral and social scientists complaining that their research is being reviewed as though it was high-risk biomedical research. And by that, I think they mean the kind of research that could kill someone. Now, when we look at these different kinds of risks and harms, are there any normative guidelines to help us determine when a risk is unacceptable?
Yes, there are. If the risk can be avoided in some reasonable fashion, it certainly should be. If people do not consent to the risk, it's certainly objectionable. If the risk is one that is not reversible, that we don't understand very well, that is seen as frightening, that's certainly very unacceptable. The question really is not, is there any risk, but is the risk acceptable? We're talking about safety, which is a very subjective notion.
In evaluating the level of risk, do we also need to take into account the nature of the participant population?
Well, we certainly do. Some participants are much more vulnerable than others. Some are fragile. They're easily harmed. A frequently overlooked harm is the harm to, for example, mental health consumers of stigma. What does it mean if a letter is delivered by your postman from the mental health department? What does it mean if you have to be seen walking into the mental health building to participate in the research? What does it mean if somehow your responses are not kept confidential? This is really very deeply a matter of privacy and confidentiality.
In an effort to control for a variety of different variables that can influence an outcome, researchers often like to use an experimental design and to randomly assign people to control and experimental groups. What are certain ethical issues that arise in the context of an experimental design?
Well, a variety of issues can arise, all having to do with the assumptions that people bring to the experiment. If people believe that the new treatment that you're experimenting with is superior, then of course people want to be in that condition. They don't want to be in the control condition. On the other hand, the new treatment may be no better than or inferior to, or it may actually be quite harmful. And so it's rather important to have a control against which to compare it. Now, the ethical basis of experimentation is clinical equipoise, that is, not really knowing what the effect of the new treatment is. If you really knew, then it wouldn't be justified to do the experiment.
The use of placebo controls is often controversial in research. Certainly you can have clinical equipoise using a placebo when there is no effective treatment in existence. You're not sure whether the experimental treatment is better or worse than a placebo. In other cases, though, there is an effective treatment, and that seems to violate this principle of clinical equipoise in that some would say we know that placebo is inferior to that. Does that mean that we should never use a placebo control when an effective treatment exists?
No, I don't think that it means you should never use a placebo control. For one thing, you often don't know that much about how effective the treatment is, how many non-responders to the treatment there are, how strong the treatment effect is. You also have to take into account how risky using the placebo would be. Would one, for example, risk suicide if the standard medication were withdrawn? Or do you have a monitoring system in effect that is so sensitive that if there were deleterious effects, you would detect them very quickly and put the person back on their regular medication?
Joan, drawing from your years of experience conducting research, reviewing research, and writing on the ethics of research, would you have recommendations to make about how we can improve the process of offering benefits and minimizing harms?
Yes, I do. I would suggest that one start being concerned about who one is studying, what their concerns are, and about the ethics of the study long before talking to the IRB, long before writing up the protocol, long before having the final research designed. Once you have the research designed, you don't want people, you're not responsive to information that will make you rethink the ethical and methodological issues.
Well, Dr. Sieber did an excellent job presenting some of the different kinds of risks and benefits that a research study can include. She also reminded us of a very important truth that's articulated in the Nuremberg Code and the Belmont Report, namely that informed consent does not justify exposing participants to any conceivable risks. We have a duty to try to minimize risks as far as possible. And finally, and perhaps most importantly, she emphasized the need to include participants across the life of a study, including at the very earliest points when we're deciding on which questions will be investigated.
I think that's a very critical point. In behavioral health research, there's a preponderance of biomedical interventions that focus on recidivism and symptom control rather than looking at well-being, empowerment, personhood. Also, most biomedical studies fail to look at the iatrogenic or negative outcomes of such interventions. And finally, there's a failure to really look at the concepts of recovery through rehabilitative approaches in the community.
So in a sense, Jean, what you're really emphasizing here is that the kinds of benefits that are going to be offered are intrinsically related to the questions that are being asked, and perhaps we need to change our funding priorities and the process of determining what questions are investigated.
It is important to remember, really, that research participants have a vested interest in the production of knowledge. I think they also have opinions about research methods that are, which ones are ethical and which ones are not. Do you think that it's abusive to do studies where you take people off of their medication?
Yes. Yeah.
You think what can happen if you take people off their medication?
They can claim suicide and they can die. I mean,
Cause for seizures.
I know.
How about if they give you a sugar pill and you don't know if you're getting the sugar pill or you're getting some sort of an active medicine?
I would know.
That's what makes the
That's another
study.
research problem.
Yeah, I
But
think that's.
But you can see some people that get placebo that will still have, progressive reports.
But how else can you do the research unless you try it? I mean, it's a research. So
Two tests.
basically
That's a
you
good
have-
point.
you
How
have
can
to
you
take
do
some
the
people off.
that kind of research and still protect people's safety?
Close monitoring of them while you're doing the research project,
Yeah.
I guess, for one thing.
Yeah, and again, I would say, it goes back to informed consent. If you know that you might be getting this medication, which might help your condition, then, you go into it knowing that, you make that conscious decision.
Well, Gene, we saw both in the interview with Joan Sieber and with that little excerpt from the discussion group that the use of placebo controls in research can be very controversial. In fact, it's a controversy that's certainly not been resolved within the medical community or among IRB members, but there is something of a consensus that there are at least 3 criteria that have to be met in order to justify the use of placebos. First, the standard therapy has to have a number of people who don't respond well to it or has to have severe side effects. Secondly, we really need to work hard to dispel the therapeutic misconception, to let people know that they're engaged in research and not therapy. And finally, we have to have very careful monitoring of participants along with rescue arms.
I think that IRBs are somewhat naive about the effectiveness of rescue arms. Unfortunately, there have been some deaths. And also, it takes a long time for someone, once they have relapsed, to recover and become stabilized within the community. I think it's also controversial because researchers really underestimate the severity of the side effects from just re-experiencing psychosis itself.
Well, and Gene, this really underscores the significance of the informed consent process, that we can't just dispel the therapeutic misconception, but really need to provide more information on the specific kinds of risks that these studies can present.
But does anything go? Let's ask our discussion group participants what they think.
They have research where they want to see the effects of crack cocaine on people. Since I'm a crack addict, I was going to go do it so I can get the government grade A crack. And they have marijuana the same way. It's like government grade A marijuana. So we was going to go get the drugs mainly to do the research so we could sit there and be studied and have watch the effects, they watch you smoke it, everything. Yeah.
For them to give this man a straight shooter, a rose glass, and a pusher, and some Brillo pads,
And a lighter.
and cook it up, and give him a lighter and set it up on high beam, and let him smoke. It's almost, it's really a comedic tragedy. It just doesn't make any sense, and I can't even imagine that would even come up under the term research.
But from the side,
That's a slap in the face to every researcher across the country. That's my question. Is there a certain ethic about whether or not, in the interest of helping people, that somebody is getting hurt also in the same interest? And then, if I may use a word, please, then we have an oxymoron.
And what is the oxymoron?
The oxymoron is that you're helping and hurting at the same time. That there are some ethics along that line in the pursuit of the help of all humanity, that we don't destroy humanity in the same pursuit, and we get into numerical numbers of saying, well, mathematically 1 died but 1,000 lived, because that 1 could have been your grandchild or my son.
Research can be and is necessarily at some point a brutal ethic. It has to be brutal somewhere along the line in order to find out if something works or not. And you have to go to the red line in order to find out if a medicine does work.
But would anything go? What would hold back a scientist? What do you think are the safeguards?
I hate to be argumentative, but people go above and beyond, break the law every day, you know?
I think it's possible. I think a lot of it has to do with a person's personal ethics.
I think that holding researchers responsible for a personal ethic is really important, but Jim, I don't really think that's sufficient. I think in risky research, we really need to create other safeguards like an ombudsperson that could advocate for research participants and could ensure their protections.
Well, Jean, you're certainly right, especially with high-risk research. We need more than just standard IRB processes, but more sophisticated monitoring of the informed consent process and in other aspects. But her point also has some validity. We do, in the end, depend on the integrity of researchers, and that reinforces the need for research ethics education programs like this one, and special attention to fundamental ethical principles. One of our research group, discussion group participants articulated very well the fact that respect for persons cannot be wedded to a utilitarian ethic that would sacrifice an individual participant for the sake of the greater good. And we could also focus in on the principle of beneficence and the need to convey benefits to participants.
Yeah, I don't think we look enough at the benefits beyond the idea of cures for their medical conditions. One of the key benefits we found in our discussion group was that people want the results of the research. They feel it is a part of themselves. As part of your participation in research, have you ever been promised the results of the data? Like, no? You're saying no.
The one that I was really most interested in of everything I've done, I've even got a personal friendship with the guy's twin brother and have been asking his brother, please send me the results. And his brother hadn't bothered yet. But he got his PhD off of it and is living happily ever after. And I've never seen what he wrote. And it was part of my experiences, and I wanted to see the connections with other people, what his impression was, and really did feel cheated.
I've been in studies like that where it's been all about a certain amount of people filling out a certain amount of paperwork as quickly as possible so that the paperwork can be turned in, and the people who were in charge of having the paperwork done and the study done would get what they were supposed to get out of the study. And you almost felt like the people who were in the study were just animals. They were just there in order to get that paperwork so they could submit it, as opposed to how those people as individuals felt.
Central to behavioral health consumers is the belief that research ought to and can enhance consumer choice, power, and knowledge. However, there's a tension in the consumer community between the principles of consumer choice and the protections of consumers in research that involves risk. This is a consumer ethical dilemma.
Well, and Jean, so often in ethics we do find these dilemmas. We find that principles seem to collide or values conflict. And in cases like this, I'd just like to point out in conclusion that there are often two different ways forward. One is to get all the stakeholders together. In this case, it might include participants in research, researchers, funding agencies, and other groups, and to try to achieve a consensus that meets the competing needs of different people. But very often a preferable way forward is to try to bypass the dilemma altogether, and this requires creativity. In this case, for example, we might try to seek novel solutions, new study designs that go beyond the use of placebo-controlled experimental designs.